Good day everyone, my name is Francine Miklat. I'm 21 years old, your Mutya ng Pilipinas Pampanga 2024 first runner-up. I'm back here on CSA Medical Aesthetics. I've been here 10 months ago for my nose lifting and it really boosted my confidence, especially as a beauty contest candidate. I was able to unleash the inner beauty within me. And now I am back here to try the skin booster and chin fillers. Of course, we're never gonna get tired of coming back to the best clinic in town. Don't forget to click the notification bell and subscribe button.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up. Let's all welcome Francine Miklat. Welcome back. So 10 months ago, is that correct? So we have done the non-surgical nose enhancement for Francine. So from then on, how is it like right now?
I think as a beauty queen po, hindi na po kailangan ng nose line na marami. Kasi kahit kaunting contour lang po, lumilitaw na siya agad. Actually, kahit hindi ka na mag-contour.
Correct. Kahit hindi ka na mag-draw ng line on the sides. Kasi in the makeup nga naman, no? So our makeup artists, they are like drawing a curvilinear line on the sides of the nose. Or we call it the dorsal aesthetic line in our field. And that line should be symmetrical. Dapat parallel yon. Some people will notice parang skewed a bit yung kanilang sides of the nose. Pero kay Francine, hindi naman skewed. It's really straight, di ba? From beautiful to more beautiful nose. Now, our goal for Francine is to improve the shape or contour of her face. Because I noticed round shape, baby face pa. Okay? So we Asians, we actually have this round, wide, short face. Yan ang typical face shape of Asian people, of Filipinas, like Francine and me, right? So, it's kind of like our face is like stretched horizontally. If you compare sa mga Caucasians, their face is stretched vertically. That's why their face is kind of like narrow, but longer, okay? But then, the Caucasians, they actually wanted to somehow like create or make a round shaped face. I remember when I was in Europe, they were asking me how to make their face round shape. And I was sharing with them, in Asia, they want their face not round. They want it like narrow or like oblong shape or oval shape. Or like if you have an egg, yung inverted egg, yun yung shape. Or right now in Korea, V contour. That's what they want. And that's what we also want for Francine. Okay, so looking at the proportions of the face, if you subdivide the face into three parts, the upper, middle, and lower, for Asians, you'll notice the lower third is shorter as compared to the upper and the middle. So we are short here. And if you look at the chin, the beautiful chin of Francine, the ideal rule is like a 1/3, 2/3. Okay, so if you do a measurement, so you are deficient a little bit when it comes to the vertical dimension or the length, this one, okay? And if you check on her Ricketts line, the Ricketts E line, the projection of the chin, deficient din. Naku, mamagsak ka dun sa mga test ng Ricketts line, tsaka yung 1/3, 2/3 rule. Yun, failed daw. And then I was assessing her masseter, okay, bite. Because I noticed she has this temple muscle prominence here. Ayan, no? Prominent. So, parang hypertrophic temporalis muscle and masseter hypertrophy. So, prominent din yung muscle. And if you ask Francine, ano ba mga pinagkakakain mo, Francine?
Nuts po.
Yun. So, lumalaki yung muscle. The muscle kind of increases in the size. Yan. Hypertrophic masseter. Now, for women, we wanted like a narrower angle of the jaw, of the mandible. Kaya we want it V-contour. And we want our cheek with that OG curve or that cheek projection. So, narrower here, a bit longer here, and projected. And somehow, with still that good jawline definition for women. Okay? And we don't want the fat bulge. Meron pa bang fat bulge here? Or the so-called jaw fats. So those are the things that we want to treat for Francine. So what kind of treatment, what procedure, we will show you when CSA Medical Aesthetics return. Okay, so we're working on Francine's lower third of the face. So when you say the lower third of the face, okay, subnasale, make a straight line, horizontal line to this lower lobe of our ears, and the inferior line will be your mandibular border here, okay, and this is the posterior, okay. So we'll work on the chin because we have to correct the projection, the rickets E line, and we need to also improve the length of the chin. So we'll work on this so-called menton here, okay. And then we'll be using also a device called Ultherapy. We'll be working on that one. So some areas where we don't want to touch because of the marginal mandibular nerve. So you can subdivide this area into 3 columns here. And then in this part, we want to work on the masseter. Bite for me, Francine, please. So we want to delineate the anterior and then inferior, and also make your superior line for your masseter. So we'll subdivide the masseter 1, 2, 3, 4. So same thing on the other side, okay? Creating that horizontal line. So for those who want to do their markings, this is the standard marking when we work on the lower third. So posterior, and then the inferior line here. Then we have the center there. And then when we work on our Ultherapy treatment, we want to avoid this so-called marginal mandibular nerve here, okay? And then we can subdivide. Okay, there you go. And then bite for me, please. So very strong masseter, okay? So we'll subdivide that here. Okay, I'll start with my Ultherapy device here. Again, this is the microfocused ultrasound with the visualization, MFUV. Okay, so I'll be using the 3.0. I want to reduce subcutaneous fats there. I'll start working here, and then I'll deliver my shots already on this side, okay? So you can target superficial and or rather superior and inferior jowl fats, okay? How are you feeling, Ma'am Francine? It's okay. So you can leave your anesthesia cream for about 45 minutes before doing this Ultherapy, because some people are telling us that when they had experienced the Ultherapy, they were saying it's painful. How was it, Francine? What's the feeling?
No pain.
Yeah, so she had the numbing cream left for actually almost an hour, right, Francine? Okay. So this is non-surgical, non-invasive, and it's targeting your subcutaneous fat layer. I'm using the 3.0. So my goal is just to reduce the fats, the jowl fats, and kind of slim the lower third of the face for Francine, for her to achieve a V contour. Yan. In Filipino, they say, Hugis Bigas, right? So that's the trend right now. So I'll work on the right side. So after doing this, after targeting the fat layer, I'll be targeting the masseter muscle. I'll be using the so-called botulinum toxin, okay? I'll be just using 30 shots here. So I'll just need 5 more shots, and I'm almost done. So you can also combine it with your 1.5 millimeter transducer to target the dermis fibroblast layer, and then last 2. So actually, I'm already seeing like an instant like shrinking of the fat tissues here, and last one. Okay, so let's do the masseter. I already had my marking there. So I'll be using a botulinum toxin, okay? Now, as to the number of units, it will depend on the brand that you're using and also the size of the masseter, okay? So usually in my clinic, like if I use the 100 unit per vial, I start with the 30 units, okay? You can use like 25 units to 30 units per side. And you can add more if the master is really that dominant or that strong or really very hypertrophic. Bite for me again. Okay, thank you. And then relax. Okay, I can do a 3-point injection technique. Okay. So you can deliver if you're using like 30 units. So per injection technique will be, or per injection point will be like 10, 10, 10. Okay. So I've actually given already 20 units, so I can still add some more. So I said that 3 injection points. You can make it 4 injection points, 5 injection points, or more, depending on the size of the masseter. Okay. There you go. And then let's do the chin enhancement before we use our contour threads. Okay, so I'll be using hyaluronic substance. Then I want to inject into the menton, okay, symphysis menti, onto the bone just to elongate. So one injection technique here at the border of the mandible, the center of the chin. Okay, the menton here onto the bone, and then I'll just push like half mil of this product. This is a hyaluronic filler. So this is a deep hyaluronic filler. Okay, just injecting it midline. Okay, so we follow the center of the philtrum there. Okay, there you go. So you can actually mold the product. Okay, you can add a little bit more. Some of my patients here, like if they have a shape of like a square shape, for women we want a round shape and kind of a bit pointed shape. You're still good? Yeah. So we've delivered 0.5 already. Now for the anterior projection, I make 2 injection points. So the center line, you can inject one on, for example, start with the right side there onto the bone, aspirate, and I can deliver 0.25 here. Okay. And then after that, I'll go to the opposite side, the left one. I can give like a 0.25 also there. So the left one there. You can follow the philtral column. Okay. So pushing the product already. So delivering 1 ml of my product, my hyaluronic substance here. And then I'll still use my protein threads or polydioxanone threads to do contouring. So we mentioned a while ago that she has some, or I have noticed, Francine, some submental bulge or like double chin, right? Especially when you're looking down, you're bending. Okay. So we can do our threads here. Disinfect please. So it's important that you clean the area, disinfect the area, avoid any infection. So I can just use monofilament thread, for instance, still young here, and do your step ladder technique here. Okay. So the goal here is to still strengthen and tighten the soft tissue layer here. Also stimulate collagen formation, prevent aging or sagginess, and do some contouring effect also. Turn to the left side, please. Thank you. Okay. Okay, last one. Then we can pull this out already. Yeah. So this is a combination procedure. Okay. So for the submental, I can just do 5 portions here and then just clean the area. Actually, the PDO threads were known to also have a so-called lipolytic effect, reducing some of the excess fats that we have. So I can just do another ladder pattern here. So we'll just proceed with the opposite side. Okay, so we've done the V-contouring treatment for Francine. We'll show the result when CSA Medical Aesthetics returns. And we're back. Let's show the result to Francine. Francine, here's our mirror. So we have done the V-contour treatments, combination of our chin filler, jaw tox, Ultherapy, and the PDO thread contouring to give you that narrower lower third and also that projected chin and an improved length of the chin. How are you, Francine, after those multiple injections? Plus, we also did an injection on the under chin and a little bit of the Ultherapy shots to kind of reduce the fullness under the chin. How are you, Francine?
Parang when you look at my face po, hindi na agad yung nose yung nakauna.
Yeah. So now you can see the chin also.
And then dito, Doc, you can see the instant parang nalusa yung fats dito.
Correct. I was noticing that a while ago after doing the procedure. Kind of like, it became slimmer already. Parang yung fat bulge niya, nawala na. Wow, instant. Like, the younger you start, the better because you respond easier or earlier. The younger people still have these responsive tissues. They respond to these kinds of treatments, especially collagen stimulation, tightening, firming, lifting, contouring, okay? So, when you're young, it's an advantage. And the earlier you start, the better. And it's already prevention of the aging signs. Huwag nyo nang hintayin na magkaroon na ng mga signs of aging bago pa tayo magpa-treat. Because when there's already too much of the sagginess, wrinkling, loose of the laxity of the skin, or lost elasticity of the skin, naku, mas marami na pong treatment, mas maraming injections, mas maraming sessions. So the younger we start, the better. So this is already prevention, prejuvenation already. So far, overall, how was it?
Hugis Bigas achieved, Doc.
Amen.
Amen.
Yeah, that's what we want to achieve for Francine. And so, balanced space, proportioned, okay? So, the rule of thirds, we follow that. The measurements, 1:2 ratio, okay? So, golden 5 proportions because beauty should be within ratios, within proportions, symmetrical, balanced, harmonious. Thank you so much, Francine. Okay. So, we'll follow her up. We'll check on like mga photos like after a week, 2 weeks, and see how you have achieved that V contour, that V-shaped face. Okay.
Thank you, Doc.
Very good. Do you have any social media that they can follow you?
So, you can follow me po on my Facebook, Francine Miklat, and on my Instagram, Francine_Miklat, and on my YouTube channel, Francine Miklat.
There you go. You can also follow us at our YouTube channel, Contessa Salvador, our Facebook page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. And if you have any questions, you may email us at csaskinclinic@yahoo.com. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And check out the old episode on the nose contour, non-surgical nose enhancement of Francine. It was really awesome. And I think you have a lot of viewers on that one, right?
Yes, Doc.
And they even ask you questions.
Up until now po,
Up
Doc,
to
there are
now,
a lot
right?
of people messaging me.
Yeah, so they'll follow you. They check on your transformation, a natural enhancement from beautiful to more beautiful. naturally beautiful. Yeah. There you go. Thank you, Francine. Thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.